Welcome to USMLE SARTI. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Good morning, good afternoon, everyone. We have a special guest, Dr. Abdul, here today, and he's one of our very famous providers. He helps our students get rotations, research, mostly rotations, and we're going to talk to him around his rotations and what students will learn. So, Dr. Abdul, very warm welcome to you, and we are glad you could make it here today.
Thank you so much. My pleasure.
So, Dr. Abdul, let's start with the internal medicine rotation that you have with us. So, tell us a day in the life of a student. So, when a student comes to you for internal medicine, what does he or she do on a daily basis?
So, the student will probably start in an outpatient clinic in the morning, talk about potential cases, and that they have access to that attending throughout the day if they have any questions about cases or even like topics in internal medicine. After that, they start shadowing that attending. The attending, frequently ask the student if they are comfortable writing notes, so they may participate in the notes, which it could be, a great experience. Afternoon, they will either participate in clinic cases or sometimes they can go to a local hospital here.
Okay. And how many patients on an average in a week does a student get exposure to?
I believe they see about 15 to 20 cases per day.
15 to 20 a day is a good number, so a good experience. And you mentioned that the students can write notes. Now, are there occasions when students can interact with patients, like history, physical, some meetings with the patients? Is that a possibility?
That is a possibility. It's based on the attending's discretion as well as the patient's approval.
Okay, all right. And you've been helping students for so long. What do program directors look for when they see, okay, this student has done 4 weeks rotations with your attending? So what are the program directors looking for?
The program directors are now looking for authentic experiences. They know that sometimes students can come and shadow and do some kind of experience, but as the match is getting very competitive, they look into the details of the LOR. Sometimes they reach out to these attendings. They also look into if this clinic is affiliated with prestigious hospitals in the area. So all our clinics are, affiliated with, prestigious hospitals, the two major healthcare systems in the area. Our students, we have had significant success rate with the match, up to 70 or 80% of our students match. Our attendings help the students with applications, guidance. Most of our attendings, not all, but most of them are also IMGs. So they have been through that kind of experience. They want to help our students and do whatever we can to help them in the application process, be there for them.
And what is the typical, say, patient pathology demographics that students end up seeing in your clinics?
Big variability. We have a lot of variables. We have like patients, variety of experiences, like outpatient clinics, so they might see like outpatient scenarios like in internal medicine, management of chronic diseases. If they get access to the hospital, they will see acute care, things that are life-threatening issues. Also demographics, we given that we're in suburbs of Cleveland, it's a diverse area, so we have like African American, white, Asian, big Middle Eastern population here as well.
Okay. And you mentioned suburbs of Cleveland, and I know winters can tend to be very harsh. So what are the logistics? How will an IMG manage? Is it Uber, or do they get some housing nearby? How do these IMGs navigate the city?
That's a very good question. So I think, thank God, we're still in the Midwest. The cost is not, very high. So if they stay in one of these local extended stay, for example, hotels, we have a lot of people who stay there. They sometimes take the bus. Some of them, get an Uber or even rent a car. But if they're, close to us, sometimes even they walk. There are like some extended stay, hotels, or some of them got an Airbnb, and it's a walkable community.
Yeah. Well, thank you, Dr. Abdul. This was great, and very great insight into your internal medicine.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.